My name is Miad Najafi. I'm a registered osteopath here in the UK and a physiology graduate. I'm a Brazilian Jiu Jitsu black belt under Ricardo de la Riva, and I'm also a JKD Kali black belt under Bob Breen, with some experience as an amateur boxer. So I've been involved in physical training, martial arts, combat sports and rehabilitation for over 25 years now. And I wanted to put together the next volume of the Grapplers longevity program, which is a specific exercise program, not necessarily designed to treat any injuries as such, but to aid mobility and to keep the body robust and healthy, and to minimize the risks of injuries for the grappling athlete, but also to empower the athlete with more knowledge about specific areas of their body that are prone to injuries. Ultimately, it's designed to keep you mobile, healthy, and training regularly into your 30s, 40s, 50s, and perhaps beyond. This is the next volume of the Grapplers longevity program, which is volume 2, which will be focused on the shoulder joint complex. The shoulder joint complex has got a very unique anatomy, and it would basically consists of bony structures, which include the upper arm, also known as the humerus, the scapula or the shoulder blade, and also the collarbone, which is also known as the clavicle, as well as other soft tissue structures which help to support and move the joint. The true shoulder joint is a ball and socket joint similar to the hip joint, but with a very important difference. The hip joint is a deep and very well fitting, congruent joint, whereas the socket of the shoulder joint is considerably shallower, and so it's not as deep a joint, and it's not as well fitting. This makes the shoulder joint a more mobile and versatile joint when compared to the hip joint, but it comes at a sacrifice in terms of stability. Stability, however, is aided by several other soft tissue structures. There are some ligaments which support the joint over the joint capsule. Within the joint, around the edge of the socket's called the glenoid, and around the edge of the socket there is a cartilaginous ridge called the labrum, and that actually deepens the socket and makes it somewhat better fitting or more congruent. And then there's an important group of muscles known as the rotator cuff, which many of you would have heard of, and these are very important in maintaining the integrity of the joint, but also involved in aiding its movement. But not all movement happens at this glenohumeral joint. Not all of the movement of the shoulder girdle happens at the ball and socket joint. We have movement that happens between the rib cage and the shoulder blade, so as the shoulder blade rises up and down. We also have movement that happens between the shoulder blade and the collarbone here, right at the tip of the shoulder, and that's the AC joint. Some of you may have even injured your AC joints in the past. And then we have also another joint between the breastbone, the sternum, and the collarbone. And you may even be able to feel that if you raise your arm up and down, just that you can maybe feel that your collarbone is rising and perhaps even rotating under your finger. There's also a very important element of very broad muscular attachments that attach onto the shoulder girdle. So we have the pec musculature, which attach onto our ribs and our sternum, but we also have the trapezius muscle, which is a diamond-shaped muscle that attaches onto our shoulder as well as onto the base of our skull and down our vertebra, all the way down to our lower back. And then you have a very important muscle called the latissimus dorsi, which is this broad, strong muscle. It's the biggest muscle of the upper limb. It attaches on from the upper arm all the way down into the pelvis and lower back. So all in all, you've basically got muscular attachments of the shoulder from the skull all the way down to the pelvis, as well as into the rib cage and the breastbone. So these structures working in unison, which allow for an almost infinite amount of activities to be undertaken by the upper limb. But with it comes a certain vulnerability and a potential for overuse and traumatic injury. So it's important to minimize this with empowering yourself with more knowledge about the shoulder girdle, looking after it with sensible maintenance exercises, including mobility work and strengthening work, and some lifestyle changes in terms of perhaps ergonomics, dietary changes, some cold and hot hydrotherapy, which can also help with recovery and repair. We're now going to discuss the various ranges of movement at the shoulder joint. Due to its anatomy and its versatility, these movements are very rarely done in isolation, but we're going to break them down into the simple ranges. So first of all is the simple flexion, which takes the arm up in front of the body and right the way up to the top. And usually we can go all the way up to the top. In a healthy shoulder should be able to do that. And then we bring it back down to the neutral, and then we have extension, which just takes the arm back in relation to the body. Then we have abduction and adduction. So abducting is taking the arm away from the midline, and usually you have to go palm up when you get to about 90 degrees. And then again, a healthy shoulder should be able to go all the way up to the top, and then we come back nice and smoothly. And then we also have adduction, which is bringing the arm towards the midline. There's also internal and external rotation. So external rotation is we can have the elbow close to your waist, and we're going to turn the arm out to the side. And then we also have internal rotation, bringing the arm in, and if you want to test your internal rotation, you can go a little bit behind you. Then we have the movement of the shoulder blade on the rib cage. And we start with elevation, which is when the shoulder blades rise up. And then we have depression, when they bring them down towards our hip. Then we have protraction, which is taking our shoulder blades forward. And then retraction, which is like pinching them in between, like if we're going to do a row, or we can really pull back. These movements very rarely happen in isolation. They nearly always happen together. And this is particularly exploited when it comes to submissions like kimuras, omoplatas, or americanas. In a kimura, if I was going to get Nina in a kimura here, we will internally rotate the arm, but we also abduct it. So we take the elbow level with the shoulder and extend it as well. So this combination of extension, abduction, and internal rotation maximally binds the soft tissue structures and allows for an earlier submission. If I was not going to abduct so much, you can see I would have to create way more internal rotation to get the submission. And that's exactly the opposite when it comes to the Americana. I abduct, I flex, and then I external rotate. If I don't abduct and if I don't flex, I would have to create way more external rotation to bind it. It's important for us to be aware of that, and also to know that we should tap early if submissions are put on us, if we want to be able to enjoy training into the long term. So now we're going to discuss some of the common conditions that can affect the grappler's shoulder. These are usually either traumatic or overuse in nature, and to really get an accurate understanding of what you may be experiencing, you need to go and see a clinician, a physiotherapist, an osteopath, a doctor, somebody who can actually diagnose musculoskeletal conditions and give you an accurate assessment of the tissues that are involved and causing your problem. So the first and most common actually injury of the shoulder, particularly in grapplers, are rotator cuff strains. So we've discussed what the rotator cuff are. They are a group of muscles that stabilize the shoulder and aid in its movement, and they're quite prone to being damaged in training. And so these are usually partial tears, but they can be complete tears as well. And usually the patient presents with, painful overhead movement, sometimes often sore to lay on the shoulder. Most complete tears will require surgical correction, and even though they're quite rare in comparison to partial tears. But the good news is that the partial tears are actually quite treatable with good physical therapy, be it exercise therapy and quality manual therapy, as well as some pharmaceuticals and other anti-inflammatory drugs. The tears actually occur where the muscle turns into tendon, called the musculotendinous junction. So this is the actual, almost like a fault line in muscles, where the tissue changes from a muscular tissue to a tendinous tissue, and the weakness there makes it prone to damage at that site. But the good thing is that generally it is quite treatable, but complete tears will require surgical correction. Next common condition is rotator cuff tendinopathies, and so the rotator cuff tendons are prone to damage. And now if that damage happens over a short period of time, then you get some inflammation, and so a shorter term irritation of the tendon is called a tendinitis. And a tendinitis is low-grade inflammation which can have knock-on effects, create pain, reduce function, some soreness, some heat, and some obviously restricted movement. But if it goes on for a longer period of time, as the inflammation declines, a tendinosis develops, and that's a more kind of degenerative, like more wear and tear, like an early aging of the rotator cuff tendon, which can occur. Usually these are treated with physical therapy, sometimes corticosteroid injection, and an ultrasound. But generally you can get good results with good rehabilitation, manual therapy, as well as pharmaceuticals and potentially electrotherapeutic devices. Bursitis. Bursitis is another common condition, particularly in grapplers. And bursa are fluid-filled sacs that sit around joints, and they're there to really reduce friction between there. So they're very slippery little fluid sacs that reduce irritation and friction between adjacent structures. They can get irritated, sometimes traumatically if we land hard on our shoulders, but more often it's more of an overuse injury, often maybe from pummeling, or if I'm really kind of like attacking single legs and double legs, and like people are sprawling on me, and that can create quite a lot of irritation and damage of the bursa. And that's called the bursitis. So that's irritation of the bursa. Itis usually refers to inflammation, be it osteoarthritis or what we've just described with tendinitis and bursitis in this case. The good news is that it's very treatable, and manual therapy and exercise therapy often does a very good job of that. There are several bursa that sit around the shoulder, but it's nearly always the subacromial bursa that sits just under the tip of the shoulder blade here that is most commonly affected. And that can happen, as you escape vulnerable positions, as opponent is trying to hit you with a submission and you're trying to escape, and it can irritate that. And if it's left unchecked, and if you don't get the correct treatment, and if it doesn't calm down, it can actually have knock-on effects and cause some frozen shoulder, a condition called frozen shoulder or adhesive capsulitis, which will really restrict your shoulder movement over the long term. So it is important that if you are experiencing any pain, that you get looked at, you get treated accordingly, and because it is actually quite responsive to therapeutics. So the next common injury are impingement syndromes. Now, impingement syndromes usually start with a tendinitis or a tendinopathy of the supraspinatus tendon, which is part of the rotator cuff, and it sits on the top of the shoulder blade here. It's actually involved in lifting the shoulder through its initial abduction. What happens is you get irritation of that tendon, and it creates a cascade of events which creates pain, and that pain causes muscle dysfunction. That muscle dysfunction creates altered mechanics, and if that goes on for a long enough period, then it will that that tendon will constantly impinge on this acromial arch and will be painful, especially it creates a painful arc in terms of when you're lifting your arm away from your body. There are other causes, and that might be some degeneration or bony spurs that have developed around the shoulder joint, be it the AC joint or the glenohumeral joint, the ball and socket joint, and that can further irritate and impinge the supraspinatus tendon and create problems. Now, treatment approaches will vary depending on what is the actual causative factor of the impingement, but generally it's pharmaceuticals and physical therapy are quite effective to treat it. AC joint injuries. These are another common injury within the Jiu Jitsu community and grappling community. The AC joint is, as mentioned previously, is the joint that sits between the collarbone and the shoulder blade, right at the tip of our shoulder. It's got an interesting bit of anatomy. It doesn't have any muscles that directly cross that joint, so no muscular structures are directly supporting the joint, and it's only got ligaments. So what happens is we get 6 grades of AC joint damage, which can be from a complete dislocation to lower grade sprains of the ligamentous structures that support the joint. Higher grade damage to the AC joint will require surgery, but lower grade work can be treated like other ligamentous injuries, and generally with exercise therapy and manual therapy and pharmaceuticals. So labral tears are an unfortunate injury that you may experience in the shoulder joint, and as we said, the glenoid labrum is the cartilaginous structure that sits around the socket that helps to deepen and add congruency to that joint. And this cartilage can get damaged, and if it gets damaged, you can create cracks, fissures, or maybe even a loose piece of cartilage within the joint space, and it will basically create irritation of that shoulder joint further and further. It usually happens from traction injuries. So if I've come in and attacked somebody's single leg and they've kind of like sprawled hard on me or stamped their leg onto the floor, and it's kind of like created traction through my bicep, that can create damage in the labrum, or more of a cock type position like a throwing position, or in the case of Jiu-Jitsu, a position like the Americana where someone's really isolating the arm in an externally rotated position. That can also damage the labrum. Unfortunately, nearly all labral cases will require surgical correction, but you can get very good manual therapy and exercise therapy to help with reducing the inflammation prior to surgery and even post-surgery, in terms of like facilitating the repair process, but prior to surgery in terms of reducing the inflammation and the pain that the patient may be experiencing. So get yourself checked out. If you've got painful clicking in the shoulder joint, you should not be having painful clicking in the shoulder joint. That needs to be seen by a professional and assessed accordingly. So now we're going to discuss dislocations. Dislocations of the glenohumeral, the ball and socket joint within the shoulder joint complex are amongst the most common of traumatic injuries that the grapplers will experience. It's usually from landing hard on an outstretched arm or directly on the shoulder, but also in more of a submission type of scenario where you've got either external or internal rotation. In the case of kimuras, Americanas and omoplatas, any submission that directly attacks the shoulder joint can potentially create dislocations there. So it's important not only to tap early, but it's important when you're putting on submissions that you do it with control and try and do it with as much control as you possibly can to minimize the risk of trauma to your opponent, because you want him back on the mats as soon as possible. shoulder dislocations can coexist with fractures of the upper arm as well. So it's important that you don't try and replace the dislocation yourselves in a gym environment. You send them off to A&E or the hospital as quick as you can to get that looked at and replaced accordingly. There is a risk of long-term instability and potentially recurrent dislocations. So rehabilitation work is very, very important, not only to help reduce the pain and the inflammation, but to help stabilize the shoulder so it minimizes the risk of that happening again, because it is one of the parts of the body that can become very unstable if you have such an insult like that to it. Now we wanted to discuss other areas of the body which might create pain in the shoulder joint, and that can sometimes be the elbow, but most commonly, anatomically speaking, it's the neck. And that can also give you pain or mimic pain that's similar to the shoulder injuries. But that will require its own assessment. It's beyond the scope of this video. We've done volume 1 of the Grapplers longevity program, which discusses the neck and the common conditions that affect the neck, and a series of exercises to keep your neck healthy, mobile and strong. So due to the demanding nature of Jiu Jitsu and submission wrestling, not all of these conditions are totally avoidable. But with the correct care and conditioning and maintenance exercises, you can minimize the risks, or at least reduce the risks of developing any of these conditions. So if you want to enjoy this great art and sport over the long term, just ensure that you develop not only healthy mobility, but a strong, robust, sturdy shoulder girdle that can keep up with the demands of Jiu Jitsu and submission wrestling. So now we are going to come to the exercise part of the video, and we're going to start with mobility work. So the first set of movements is going to be the protraction and retraction that we covered earlier. So we are here. Now what's really, really important is as we protract and retract is we want to try and really tease those muscles apart, okay, the soft tissues apart. We don't want to sort of throw our shoulders forward and backward. We want to have good muscle activation here. We want to be able to coordinate this movement, slow, deliberate and controlled. None of these movements should be uncomfortable or painful. You should stay around a 2 or 3 out of 10 for discomfort. We're going to be doing 8 to 12 reps in each direction for each of these exercises. So then we have elevation and depression. So we are going to be rising our shoulders up and then just dropping them down, okay? So rise up and then down. So again, just really try and feel those tissues taking the joint through its full expression. Now we're going to do something slightly more difficult or more challenging, is that we're going to tilt. So our shoulder blade is going to come, the tip of our shoulder is going to come to the opposite hip. Okay, so don't bend yourself in half here at the rib cage, just rotating or protracting, depressing to the opposite hip. Again, 8 to 10 reps, slow, controlled and deliberate. So now we're going to combine all of those movements. So we're going to rotate through the shoulder blade through its full expression, just circumducting it all the way over our rib cage, and really try and feel those tissues teasing apart slowly and deliberately. Then we're going to pick up and go the other way. So really shoulder blade on the rib cage, really slow and controlled, and we really want to try and feel the end of range there with total muscular control, okay? So not throwing anything around. So now we're going to do this rotational movement here. Now this is, a lot of people make this mistake and they take their arms out to the side. Now what you'll notice here with Nina, if Nina turns onto her side here, is that our shoulder blades don't directly point sideways, they actually go at a slight angle forward. So we don't want to overdo this, because this can actually pinch our shoulders if we're not careful. So our arms are a little bit forward, and now we're going to rotate one way and then the other. So then we're going to rotate and look at the palm up, and then go the other side and look at the palm up, okay? So our head leads the movement, slow, deliberate, and controlled. Good, okay? So now we have a swinging type of exercise, so we're going to go across. So this is a nice mobility work, so we're just going to take that across us, okay, all the way across. Again, try and keep it loose here, and then we'll go the other way, which is going backwards here. Again, 8 to 12 reps of each in each direction, maybe 3 sets, and now we're going to do the one behind. So we're going to make an O behind us, but we keep looking forward, okay? So my eyes are looking forward, but I'm making a big O behind me, okay? And again, in both directions, slow and controlled and deliberate, okay? Trying to keep your upper body, so it's creating a bit of a stretch through your pecs and chest, so I don't look behind me when I'm doing this exercise. So now we're going to combine some rotational movement with some breathing. So what you'll notice is this external rotation creates some retraction in the shoulders, and it opens up my chest, and it actually extends my chest here. So that's usually matched with an in-breath and then an out-breath when we go into internal rotation. So in-breath, opening up, retracting the shoulders, and then out-breath, bringing them in, okay? And again, just trying to really feel where the end of range is, and then really feel those tissues separating, but never working through the pain, only just 2 or 3 out of discomfort at most. If any of these exercises hurt, stop doing them and seek a clinical practitioner to give you a diagnosis of what's causing this pain. Should be able to do this for most of the population if you don't have any current injuries. So now we have an angle 1, what we call an angle 1, which is we're going to be here, so it's a sort of like a cocking type of motion that we're going to be rotating one way and then the other. So it's sort of like I'm throwing a ball, or I'm hitting a stick forward, and like a 45-degree angle, okay? So now this is going to be creating a good amount of rotation through that shoulder joint, lubricating the joint surfaces, but also stretching the soft tissue structures in a controlled fashion. 8 to 10 reps, and start maybe doing three sets of each. And now we have the wood chopper, so we're going to look down at our opposite foot, and then we're going to open up here, both hands, and you look at where your hands are, okay? And then we're going to come in here, okay? So we're going to open up, and then we're going to bring it down, okay? Open up, bring it down, okay? So same kind of thing, 8 to 12 reps, slow and controlled. So we're getting a movement going through our shoulders, we're getting the shoulder blade rising up on the rib cage, and now you're starting to integrate aspects of our rib cage into the movement. And obviously you would do that on the other side as well, opening up here. So this integrated movement starts to being a little bit more challenging, but it's really how our body works. If you think about what you do in Jiu Jitsu, when you're pummeling, or we're always trying to use our as much of our body as possible. I don't just do stuff with my arms, I'm pummeling in with my shoulder and my chest, and we're really using our bodies in a fully integrated way. And now we have the swim out. So the swim out is we're cocking the shoulder up, and then the elbow up, and then the wrist up. So we're going to be here like so. And again, you can see my rib cage is working with my shoulder girdle. Okay, so elbow and then wrist. Okay, so almost like we're throwing that away. Okay, or like brushing something away from us. So this really moves the rib cage, the shoulder blade, and the actual shoulder joint itself. And now we're going to do the opposite way around. So we're going to swim upwards, we go wrist, elbow, and then shoulder. And then we're going to create that internal rotation happening at the shoulder at the same time as you're elevating the shoulder and then depressing it. Good. Really like, and then you can start to really work your rib cage into this. So you can start really moving the rib cage into it. If you just find it difficult, then you might just want to use your arms, but really, you know, you want to advance it up into using your shoulder blades on your rib cage all together. So now we're going to discuss some resistance work. We're going to work with some resistance bands and some weights to help to stabilize the shoulder joint and to help with its sturdiness and robustness, specifically with exercise. So here we've got a situation where we are involved in muscle activation, but it's not just about creating dumb strength. It's not just about being able to do a maximal lift. It's about muscle activation and endurance, because an important element of grappling is the endurance aspect of it. So we don't just want to be strong for 30 seconds or 90 seconds. We want to be able to do an 8, 10, maybe even a 15-minute round. So the way that we will approach these exercises is not just strength, but also endurance. So we're going to start with an elasticated band. You can use a TheraBand. Any kind of like resistance band can work here. It doesn't need to be particularly strong. It just needs to be able to challenge you enough, because these exercises will be isolating muscle groups quite effectively. So first of all is external rotation. So what you'll notice is that we're generally quite strong in an internally rotated position. So we're used to pushing our opponents off, press-ups and whatnot. So internal rotation is quite a strong vector for us. However, external rotation is not, and grapplers can be quite vulnerable in that position here, particularly as we're very strong in our front body often. So we're going to start with some external rotation exercises. Nina's going to grab it. I could anchor this on a door handle, or she could or a heavy piece of furniture, and we're just going to keep it in the neutral position and externally rotate. Okay, so like so, exactly. Okay, now that is in a 0 degree, so your elbow is aligned with your waist. But now we're going to start at 45 degrees, so you could maybe step on it with your opposite foot, and then we're going to rotate outwards. Okay, so at a 45 degree angle we're going to rotate. Okay, and then you can make that even stronger, maybe step on it with your other foot, and now we're going to be having it in a 90 degree angle, and then we're going to rotate it upwards. Okay, so this is your external rotation. This is quite challenging, but it's actually very relevant for grapplers, because this is what your opponent's going to be trying to do to you when they attack your Kimura, where they attack for Kimuras and Americanas. They want to isolate that arm, they want to take your elbow out to 90 degrees, and then they're going to try and create some strain through that shoulder joint. So being strong in that vector is going to be quite relevant for all grapplers. Okay, now we're going to start looking at the abduction. So again, you can just stamp on it with your opposite foot. The thumb is out, and we're going to be pulling up in line with your body. So don't have the arm in front, I have it in line with your body, and you are going to lift up like so. Again, these should be 8 to 12 reps, should start to feel a burning sensation in the muscles. Do not work through the pain, any painful clicking, stop and go and be seen by your clinician. Now we're going to do some internal rotation. So here, again, you can anchor this to a door handle, neutral position, and we're going to just go from neutral into an internal rotation position. Exactly. Okay, so we're going to be here like so. So then we can do that in 45 degrees. So you would have this again on a door handle behind you and internally rotate, keeping the tension going through the band and rotating like so. Okay, and then finally, most challenging one is at 90 degrees. We're going to be upright like so, and we're going to bring it forward into that 90-degree movement. Okay, so slow and controlled, keep the tension going through the band, and just try and get up to a certain idea that you're getting a little bit fatigued, and challenge that fatigue a little bit more, but never work through the pain. This is very important. None of these exercises should be any more than 2 or 3 out of 10 for discomfort, as mentioned previously. So what we're going to do now, we're going to help to activate some of the shoulder blade stabilizers, and we can do that in a graduated way, but the simplest entry level is to just lean up against the wall. Your hands are directly in front of your shoulders, the pad of your knuckles is contacting the floor, the wall, and your fingers are nice and wide. So what you're going to do, as you put weight through your arms, you keep your elbows straight, and you're going to drive your shoulders backwards and forwards. Okay, so keeping those elbows straight, and now forward. That's it, just protraction and retraction at the moment. That's it, backwards, pinch the shoulder blades together, and then forward. Okay, backward and then forward. Okay, and then you can start doing it with a bit of elevation and depression. So you're going to elevate and then depress. So again, it's combining that movement and really trying to challenge those shoulder blade stabilizers and really activate them. And keeping that weight going forward as you're doing that. Good. So this would be the next level as we graduate through this stabilizing of the shoulder blade. So now we're going to be on our knees, 45-degree angle, and again weight going through our hands are directly under our shoulders, and we're going to just retract our shoulder blade back and then bring them forward. Okay, so trying to open out the chest and then closing off and opening up the back. Okay, so again, just trying to work that shoulder blade on the rib cage through resistance, and then you can elevate and retract, so you can bring your shoulders up towards your ears and then drop them down, and keeping that weight going through your shoulders. And then the final one is to circumduct, is to kind of do the combining those movements. And again, you'll see this in elements of yoga, you'll see this in elements of traditional strength training, Hindu push-ups, and this is a very effective exercise to stabilize the shoulder and make it stronger. You can extend this and make your legs straight, and you can do exactly the same thing in a plank position with protraction, retraction, elevation and depression, and just keep yourself engaged, weight going through those hands. Okay. So what we're going to do now, we're going to discuss some more integrated work with regards to our resistance work. So that's going to include a resistance band as well as some weights. So the first one that we're going to be doing is a kind of similar moment of starting a petrol engined lawnmower. So we're going to anchor the resistance band under the opposite foot, and we have the opposite hand gripping the band. And what we're going to do is we're going to open out here. So we're going to start by grabbing and opening out here and lifting all the way up. So maintaining that tension going through the band one way and then the other. So it's really using the whole of the shoulder girdle, Okay, we're going from a slightly internally rotated adducted position into an externally rotated abducted position. Okay, some sort of slight flexion to slight extension. And then you'll see that my shoulder blade has to work, my rib cage has to activate, and my whole core is involved in the process. So this is one of the important takeaways with regards to this video, is that the shoulder is not as isolated as we may think, and really to use it properly we use our whole body, not just the shoulder itself. The next exercise that we are going to cover, we're going to do some halos with a weight. I've got a 10 kilo weight here, depending on how strong you are, anything from a 5 kilo to a 15 kilo weight. Doesn't need to be particularly heavy, and we're going to hold that, and then we're just going to rotate it around our head and bring it back into neutral. Okay, so now this is again just asking a complex question of the shoulder girdle with tension going throughout the girdle, weight going from one side to the other. And again, doesn't need to be too heavy, and it needs to be just sustained contraction as we're doing it. 10 reps, 12 reps, one way and then the other. So now we're going to do some work with the kettlebell. Okay, so this is a 5 kilo weight. It doesn't need to be heavy, these exercises, because they're balancing exercises basically. So 6 kilos, 8 kilos for most people is going to be more than enough. Okay, so if you're a little bit weaker, maybe 4 kilos, 3 kilos even. So what we're going to do here, we're going to come up and this is the first stage. We're going to balance the bell. This is the most important element of what we're doing. We're balancing the bell. Okay, then we can start moving the arm around a little bit. Balance that bell. Now we can start to move our feet. And feeling that muscle, those muscles activating a bit, like so. Then you can actually start to walk with yourself, balancing the kettlebell upright. So it's a bottom-up exercise, and that's why it's much more challenging on the shoulder. This is not what I'm doing. This doesn't challenge the shoulder in the same way. This is about creating muscles, the muscles that fire at the right time, and that really help to stabilize the shoulder. So now we're going to cover a very good exercise with regards to the kettlebell, and that's the Turkish get-up. This is a whole body exercise, but it's particularly good and challenging exercise for the shoulder girdle. So here, I'm not particularly big or strong guys. I've got an 8 kilo kettlebell here. You can play around with what seems to be appropriate for you. It doesn't need to be particularly heavy, but you need to get the technique correct. So we're going to start on my backs, like so, okay? And the arm is straight, the shoulder girdle is engaged, okay? So first of all, we're going to just start with just pushing the shoulder blade up, and we're going to go up onto our shoulder and look up at the bell, okay? So arm is straight, we're going to look up at the bell, we're just going up onto our shoulder, okay? That's the first stage. Okay, now we can start to come up onto our elbow. Okay, so we get our elbow right underneath us. Again, it's got to be comfortable with this. So elbow, coming up onto our elbow. Now, the next level is to come up onto our hand. So we're going to come up onto our hand. Control, coming back down, shoulder, back, and then so it's the same thing. So we're going to go back onto our shoulder, onto our elbow, onto our hand. Arm is straight. Now if you want to take that a little bit further, we're going to come up onto our knee. So we're going to come up onto our hand, and we're going to stand up like so onto our knee, and the next stage would be to stand all the way up looking at the bell. So here, we're going to come up onto our hand. We're going to do a little stand-up technique and bring our knee behind us. And we're going to go upright, like so. And we're going to come back down exactly the same way. So just like with all exercises, don't rush on to the last bit. Make sure you get your technique right, the first stage, the second stage, and then go up to the next level. Don't be in a rush to go on to the final stage. Stay controlled, make sure you're comfortable with each individual exercise before you go on to the next level. So to summarize, we are trying to take our shoulder girdle through its full expression. The different joints are getting moved and articulated with control. We need it needs to be pain-free, so it needs to be within the pain-free range. We're just touching 2 or 3 out of 10 for discomfort, and we are going to try and stabilize and strengthen the shoulder blade or the whole shoulder girdle with these exercises as well. So it's not just mobility, it's also stability. And we cannot avoid, as mentioned previously, the neck and the mid-back, so you may want to refer back to volume 1 of the Grapplers longevity program for some exercises of how to take care of your neck and surrounding structures. It's really important that you get adequate rest. It's really important that you eat well and you get the correct amount of sleep. So really you need to be at least 7 hours sleep a night, but the more physical of you will require more. A couple of other bits of advice that I would say: that you need to be nice and warm before you do any hard sparring. So get your heart rate up, get a good sweat on, make sure your tissues are nice and warm. That doesn't mean just a light stretch and then smashing into hard sparring. Get the blood pumping, get the nervous system woken up, because the muscles need to be firing at the right time. It's important for us to be aware of that. Tap early, okay? Tap early, be very mindful, explore where your end of range is. That's absolutely fine to do that. You do need to find out where your end of range is, because everybody is slightly different. So don't slam on submissions really quickly. You want to have your training partner back in the gym for the next class. So it's important that we train smartly, tough training, but being smart with it as well. It's going to add to the longevity not only of your career but also of your training partner's career. Listen to your body and try and look out for the signs and symptoms of overtraining. These can be anything from headaches, insomnia, fatigue, aches and pains that just won't budge, maybe even anxiety and depression, and perceived exertion. So if you're sensing that things that you could do before are just getting harder and harder to do, maybe your heart rate won't settle down. These are kind of like things that, the cardinal signs of overtraining that you want to be aware of, because I do believe that this is quite common within the Jiu Jitsu community. So try and be mindful, take rest days. If you do train 4 or 5 times a week, try and have rest days in between those sessions, so you're not having 5 days in a row and then having 2 days off. There are some other things that can really help with our recovery and repair process. Cold hydrotherapy is one of those things. So, maybe start introducing cold showers, look up the Wim Hof method, but it's not Wim Hof. He's not the only person that does it. There's quite a lot of other people that have been doing it for a long time. Has good anti-inflammatory effects, but it is suggested that you don't have a cold shower immediately after training, which is what a lot of people thought that you needed to do. So we do need to let the inflammatory process kick in after exercise. So at least 2 hours after training is what I would suggest. Usually I actually do it the next morning after a hard training session is a perfect time to have a cold shower. Sauna seems to work in a very similar way, slightly different pathways, but saunas seem to have good, potent anti-inflammatory effects, basically. So, bear that in mind. If you have access to a sauna, then make some use of it. In terms of supplementations, your essential fatty acids, your omega-3s are very, very important, 6 and 9, also vitamin D, but there are some anti-inflammatory spices like turmeric and ginger, which are very, they have potent anti-inflammatory effects. And then of course you have bromelain, which is a pineapple extract, which you may want to take particularly after an injury. If you been prescribed anti-inflammatories, bromelain would be a good example of a supplement you may want to consider. And of course CBD oil, which is freely available now, and there's many different forms of it on the market, and that can be very effective and has been shown to have good recovery and anti-inflammatory effects. But all in all, enjoy your training, train smart, train for the long term, stay mobile, stay strong, keep your exercises up, and look after your bodies.